Welcome to the Dementia Researcher Podcast, brought to you by University College London and the NIHR in association with Alzheimer's Research UK, Alzheimer's Society, Race Against Dementia and the Alzheimer's Association, supporting early career dementia researchers across the world.
Hello and welcome to the Dementia Researcher Podcast, bringing together early career researchers and leaders within the field to discuss their research, hot topics and to share career tips. I'm Adam Smith, I'm the Programme Director for Dementia Researcher, and today I have the pleasure to be recording on location at Trinity College in Dublin.
Hello.
Hello. This is Trinity College. Located in a beautiful campus in the heart of Dublin's city centre, Trinity is Ireland's highest ranked university. It's home to 20,000 undergraduate and postgraduate students across all major disciplines. Trinity's tradition of independent intellectual inquiry has produced some of the world's finest, most original minds, including writers Oscar Wilde and Samuel Beckett and scientists William Rowan Hamilton and Ernest Walton. It's also the home of the Global Brain Health Institute, or GBHI, which happens to be the topic for today's podcast. So let's meet our guests who are going to talk about that. It's my pleasure to welcome our three guests, the incredible Dr Dominic Trepel.
Hello.
The amazing Dr Claire Gillan.
Hi.
Did I say that right?
Yes.
I did. And the fantastic Dr Alejandro Lopez at Valdes.
Hi everyone.
Why don't you all introduce yourselves properly and what you do at GBHI and what your own field of research and expertise is. And I'm going to go to Dominic first.
So, hi, welcome to GBHI. My name's Dr Trepel. I'm the faculty health economist here at GBHI. So, a lot of what I do with the programme is getting people to think about what they're doing has to represent value for money. So, we would encourage the fellows to learn about what governments need to do to spend resources towards dementia.
And that's important because that's not thought about as much as I think it should be, and that by doing that at that stage, I'm guessing that this helps problems down the line with translation. One of the topics we've talked about on the podcast before and has come up in our blogs quite often, particularly from NIHR fellows, about some of the frustrations of developing a great intervention and then that intervention just lives in the form of a nice publication and doesn't find its way into actual real life services. And I'm guessing that's where health economics and value assessments can make a difference.
Yeah, so increasingly lots of research funders require a health economist to be part of a funding application so that from the very inception of a project, value for money and cost effectiveness is being thought about. So the likelihoods of translation are vastly improved if you're thinking about what do governments need to see to implement something in a real world setting. If you in the absence of that, if you do that, you're very likely to have exactly what you say, something that just ends up on a shelf.
Brilliant. Then I'm definitely going to get you back to do an entire show just on that topic. Thank you, Dominic. Claire, why don't you go first?
Sure. So I'm an associate professor of psychology here at the Global Brain Health Institute, and so what my lab is interested in is using data science techniques and big data sets, citizen science, things like this, to push the needle forward for brain health. So we work a lot in the digital space to make sure that our data sets are big enough to produce impacts or insights, I suppose, that are reproducible and that we can try and roll out across large populations.
So is this, do you reuse other data sets as well, or are you also creating your own great longitudinal cohort there?
Yeah, so we're not focusing necessarily on longitudinal cohorts, but we generate an awful lot of data. So we have a smartphone app that has 20,000 citizen scientists. Oh, wow. It's called Eureka. And so they log on and donate their time to try and generate new insights that can help us learn about brain health. So that's across 120 different countries, people logging on and spending their time kind of sharing their life with us to help us learn.
That's brilliant. We've had the game changer people on the podcast before as well, talking about that spatial navigation.
Work. See Hero Quest.
Yes,
yeah,
that's
absolutely,
right.
Yeah.
Brilliant. Thank you very much for joining us, Claire. And Alejandro.
Hi everyone, thanks for the invitation to the podcast. I'm an assistant professor in engineering, so I'm part of the School of Engineering, particularly interested in neural engineering, specifically on translational aspects of neural engineering from the laboratory space to the real world. more in tune with neurotechnologies and how this neurotechnologies can support brain health throughout the lifespan, and find more ecologically valid settings where we can start translating the findings that we have in laboratory environments to real world situations where we're engaging in social interactions and there is an effect of whom and where you are at that particular time.
Brilliant, that's fascinating. And of course, so you've all talked a little bit about your own field, but then you all have this other role, which is of course as faculty for GBHI, which is what we're going to talk about today. Thank you. So Claire, if I could come to you with the first question for the podcast, why don't you give us an introduction to the Global Brain Health Institute, or GBHI?
Okay, well, I'll do my best because it's a very unique opportunity, I think, particularly in this space of brain health from someone with a research background. It's a program, it's a leadership training program for people across all kinds of different disciplines, from basic research to policy to economics that was mentioned earlier, all the way to the creative arts and journalism. The idea is we take people in who are really poised for leadership. We bring them in here to interact with one another, to expand their own knowledge, to think outside of their silos, and come out of the program in a better place to enact the kind of change that we all want to make in our own siloed and perhaps smaller ways. So it gives people a much bigger vision to realise the big changes we want.
And I guess, so that's an opportunity then to step away from whatever they're doing day to day, to have that big picture view that we often know that we don't get.
Absolutely, and what's nice about it is it's a 12-month residential program, so either based here at Trinity College Dublin or at the University of California, San Francisco. So people literally come in and have this wonderful new bunch of contemporaries with vastly different backgrounds and really can grow and bounce things off each other in a way that is very unique and that normally we don't have the opportunity to do.
And I can attest to the benefits of that as well, because that's what we do at Dementia Researcher as well, the idea of bringing basic scientists together with clinical researchers and qualitative and care researchers, because new things emerge from that, don't you? I guess I'm putting you on the spot here, but is this, I mean, you mentioned your own work there. Are you an alumni of the programme yourself?
No, I'm not, but I've worked with many fellows. I think one of the more interesting things that we're doing now that's very new for me as a basic scientist is thinking about applying sorts of data that we collect through our app for basic research in lower income settings, and the potential for these to be used as scalable diagnostic tools. So working with a fellow in Chile, for example, translating our app to Spanish and rolling it out broadly in that context. Something I, as a faculty member, would have probably never arrived at on my own.
Yeah, and I guess by bringing everybody with these various backgrounds together, you've got a great advisory group. You can just go and ask somebody who's from India, I guess, about whether something would translate there or how that would work. That's brilliant. And so you mentioned Trinity College and UCSF, so that's in San Francisco. And can people apply to be in either place, or do you get placed?
So you apply in general to the program, and you can of course indicate the kinds of people that you'd like to work with at the two sites and any preferences that you have. But ultimately what we're trying to strive for is a multi-site program that's balanced in terms of the disciplines and the countries of the world that are represented. So there's a little bit of thinking about where might someone benefit from being the most, depending on their particular background, etc. So you apply generally to the program, and then you are placed with some of your preferences in mind.
And is it, I'm jumping ahead to a question I got for later on, but is it the same then? I mean, if you go and go to UCSF or you come to Trinity, I know that there's a taught element to this program as well, isn't it? Is it the same?
The taught element is shared across the sites and aligned as much as possible, but the experience is very different, because the experience is definitely depending on the site that you are, the clinical rotations that you get involved with differ vastly from the UCSF cohort to the Trinity cohort, and the expertise of the faculty as well are different. So those interactions make the program unique at both sites. So it's always good to have a look at the faculties in different sites and be able to pinpoint what you'd like to do, what aligns more with your future plans and your ambitions, because you could definitely find some key differences between the two sites.
And if you want good Guinness, you come to Trinity, and if you want kombucha, you go to San Francisco.
I think it's also fair to say that every year when we put together a cohort, we try to make one cohort. There isn't two cohorts at each site. So we have a lot of touch points throughout the year where we bring people together. They have a leadership development week that they spend together. They often also go to the AAIC conferences together. So they have opportunities to break down that siloing so that amongst themselves, each year, every cohort is very tight and very, knows each other very well, even if they are at opposite sites.
That's brilliant that you make I imagine that's quite challenging to make people feel the same cohort when they're at opposite sides of the world. But I know from having interacted with some of your fellows at the conferences you mentioned that they do come across together as a single group. So well done on that. So you touched on before what makes the program unique in terms of bringing together, you talked about artists and basic scientists and clinical people. What else, is there anything else you'd say that makes this program unique, Alejandro?
I think the diversity of the program itself is very unique, but also the fact that they're not coming here to stay, but they're coming here to train and then go back to their regions and make an impact there. I think that is one of the key flagships of the program, is we're seeding and training around 600 leaders in brain health that can have an impact back home. And that could be in a myriad of areas. Could be clinical, could be practice, could be policy, could be awareness, advocacy. So that really brings a program to the forefront of how we approach brain health issues at the moment, and allows us to topicalize the broadness of brain health to each particular region. This translatability from concepts to practice within specific cultures, I think, is key for creating good impact worldwide.
Let me just pick up on that brain health there for a second, because obviously this is the Dementia Researcher podcast, and we mostly have people who work in Alzheimer's or neurodegenerative diseases more generally. But when you talk about brain health here, is this lifespan brain health? Is this people who might work with people with Alzheimer's, but they might also be working in, say, mental health challenges, or younger people? Or
I think as a program we have a strong emphasis on dementia, but I think that's within the context of brain health. And so there's this growing hypothesis, particularly given our reflections on many years of failed trials to find a curative treatment for dementia, that you have to do things earlier in the life course. So I think with GBHI's mission in brain health, we are considering anything. So we are going from childhood. We have a child brain health group where we're thinking do things like education have an impact on later life outcomes. And also a lot of the literature recently has focused on midlife modifiable risk factors, so there's a great emphasis on that. And also when we start to throw those paradigms in, we're thinking much more in terms of public health than just clinical post-diagnostic. Where are the opportunities most likely to be best? So one of the programs of research I'm doing is on the economics of brain health, and that's really trying to say, well, where should we invest our money throughout any life course? Possibly that next drug treatment could provide the best benefit and best return on investment, but maybe there's things that we do early on in life that could equally be a good investment. So this could be the next stage performance that gets people breaking down the stigma and talking about early and midlife risk factors, and sort of, seeing similar paradigms to what we've seen with heart disease, where people are now proactively going to get them checked. We don't do that with our brains, so I think that's the future.
That's great. So that really clears this up for me. So this isn't about being a dementia researcher already or working in dementia. If you're a occupational therapist that works with professional sports people, for example, or in coaching or something like that, where we know there's lots to talk about the impact of concussion with friends. So this program would also be for you as well. It's about that. Or if you're a dietitian, for example, looking at what we eat or plant-based diets and the benefits and things. Those brilliant. That really clears that up for me. So lots of your fellows, I imagine, whatever field they work in, they'll be quite passionate about what they do, and they're clearly, to apply for this, they want to improve themselves, society and work. So generally speaking, what more do you think these we can do to influence policy? You touched on there about, because obviously there's lots we can do as individuals, but we know whether that's government policy or the society we live in, this has to all contribute to brain health. What more do you...
So imagine that you're a fellow who's come to our program from a lower resource setting, right? You might be the only psychiatrist, neurologist, or geriatrician in that context. The likelihood is that you do have to do a lot of clinical work, but you will also be that person that the government might also just turn to and say, what do we need to do about this agenda? So when fellows come to our program, whether they're clinical or from other backgrounds, they have to learn health economics, for example, is a program that I teach them. So all our fellows will learn health economics and how to make economic arguments for developing services that are sustainable and can be implemented in a real world setting. What the fellows will then do is that they've just done the practical exercise there. We encourage them to also imagine that they are speaking to a national decision maker and presenting that argument. So they're also learning skills of how to lobby and maybe argue against other agendas, because dementia isn't the only agenda that a healthcare decision maker will be thinking about. They will think about cancer. Some countries it's malaria and nutrition if it's lower resource settings, and trying to understand what the trade-off is of investing there. So the fellows do that. They think about doing that in a practical sense in a safe confines of where we teach, and we encourage them to do that. So we've seen lots of our fellows go out and speak to the WHO. So we have fellows who are advising there, to the OECD. So we have people that are advising in kind of sandbox arenas there, and also all the European Parliament, for example. We've had fellows be invited to speak there, and then most of our fellows come away with a much bigger position towards speaking at a national context in their country. They should be recognised far more as a local expert.
And given that confidence as well, that they can feel they can speak with authority, and if they've come from whatever field they've come from, I guess making a case for why that, whether that's music in research or arts or things like that, are important. So we've talked a little bit about leadership. So practically, take me through. Somebody comes here. So it's nice and summer. They've just travelled all the way from Brazil. They arrive in Dublin, realise the first thing they need to buy is an umbrella, and having bought their umbrella and an overcoat, what are they going to do every day? How are they going to spend that year on campus, or are they on campus? What do they do through the course of the year?
They are here in campus. They're actually literally just a few doors down here working away.
So in this room?
Yeah, usually in this room.
But the course is divided into modules. So there is, of course, leadership modules where they train in leadership, they come together as a group, they meet everybody for the first time and everything, and then they split up again into pods, learning skills for proposal grant writing, for example, and making sure that they'll be able to source funding for their future endeavors. They also have taught modules about the psychosocial and physiopathology of dementias, brain health, health economics, and other skills like presentation skills, for example. So they have all these training modules throughout the year. And on parallel to that, they're preparing a grant proposal that they'll be submitting for the Alzheimer's Association pilot program towards the summer. And we mentor them throughout that process. They have their own original idea of the project that they would like to start as pilots. And we make sure that that is in line with where they're headed in the career-wise, so that they can use this as a platform and trampoline to keep having impact.
Right, so this is, a very practical introduction to many things. So if you arrive here and you're an artist that doesn't kind of really know anything about the neuroscience part, you're going to have a module which is on neuroscience.
Correct.
That's going to be pitched at your level, though, that you can understand.
Yeah.
If you're a clinical person, you arrive, do you also kind of go off and talk about the psychosocial interventions? It's the same for everybody.
They're together all the time, so they're having the same courses, and this enables them to have discussions from the very expert voices to the fresh set of eyes in the groups. So it's really interesting to see how they interact and how they assimilate the material, and the discussions that they have afterwards as well, because they have everything is facilitated by faculty from GBHI, and then they go back to their fellow room and they have the discussions on their own. So it's really interesting to see those interactions, particularly for people who come from non-clinical backgrounds, discussing all the clinical aspects. There's case studies, there are round tables, there the clinical lived experience. All of that information gets cemented throughout the their peers as well.
I love that. I imagine that really pushes some people, not just, that pushes everybody out of their comfort zone. So you're not going to turn up here as a clinician and feel uber confident that you know everything, because the chances are you only know your bit. And there'll be some part of the course that's not really something that you thought of as part of your clinical training. So that's brilliant. That sounds like an exciting year. So anybody who's thinking about listening, we're going to move on now. Thinking about listening. Anybody who's thinking about applying, we'll move on now. And I'm going to come to Claire to ask. We've already touched a little bit on kind of. I do have one question about what kind of people apply. We've clearly made out everybody applies who might be a future leader in brain health. Is that age specific? I mean, you know, do you have to have already achieved some career stage that makes you eligible?
No, there's no hard and fast rules. A general guiding principle that we have is what we want to do is, we use the phrase bend the arc for people. So we want to achieve the maximum amount of impact for the world from the money that we invest in supporting and the training we provide to individual fellows. So we think about people where, as great candidates, if they could come here and they leave this program propelled towards the next thing, if we can triple or quadruple the impact that that person might have. So it's really by thinking about the individual person. Do they come in with this zeal, with the values that we espouse as part of GBHI, and this, you know, interest in changing the world? And if they do, and we think we can have a big impact, that's a perfect candidate for us.
Great. So no age specific, and it's obviously anywhere in the world as well as we touched on. And what makes for a good application?
Passion, I think, is a big part of it. We want people to typically, not always, have demonstrated some sort of track record in terms of their interest and engagement with the brain health problem, as we've discussed earlier, broadly defined throughout the lifespan. So people who are really engaged with this problem and can show they have some commitment to it, but have much more to grow. So that's a really good application, hearing the enthusiasm, the ideas, and I would say particularly for me, the ambition in the ideas. We want people who want to change the world and want to be an agent for that change. And those are the applications I think that really shine.
I'd just add as well, I think, because the programme has the Atlantic Fellows for Equity in Brain Health, so the word equity is important there. So when we're looking at applicants, we also want to see applications from people who recognise the inequalities that people with dementia or brain health problems may face. So they might be trying to target an underserved community in whichever way they perceive that. So that, for our values and our mission, is super important. That people are, for example, if they're coming from a lower resource setting, they may be setting up the first service. But if they're applying from a higher resource setting, you know, what are they doing to address some inequities in their world? Are they going to do something locally that speaks to that? Or are they going to work at a global level and try to, you know, share, for example, good research in the UK to benefit other countries? You know, so that some of what may be learned elsewhere can be of benefit to places where there is, you know, a gap still.
And having prepared for this discussion today, and having read the biographies, which are all on the website, if anybody's interested to see if you can find somebody like you, if you know, all the cohort of fellows from previous years are all on the website, and you can read about their work and what inspired them. I definitely suggest you go look at that. Is you don't have to kind of be looking at a big group of people either. You can be very interested in a very small niche group of people that are particularly affected, and the programme would still support you in that work.
So I think I just want to bring in, we've been around we're now into our 7th cohort, so we have 200 people who are in the field, and the programme was partly modelled on the Rhodes Scholarship, which is a lifelong fellowship. We're trying to make sure that people, they might take a small group, but if they're taking a small group, they're committed to them for the long term, and they're trying to drive forward an agenda with that. Hopefully they're trying to make as much impact as they can. So, you know, the impact goals are going to be increasingly important to the programme over time. So to try and make sure that people, once they spend that 1 year with us, they go on, they have a solid 5-year programme of at least of what they're going to try to do beyond this.
Well, that's a good question then. So what's the legacy after this? I mean, I did have a question here about how people can you give me some examples of what people have done after the programme? But when you leave the programme, then you don't just say goodbye and they vanish. There's a legacy to this.
Mm-hmm. So the programme runs like an alumni programme. So there are pots of money, for example, that fellows will apply for to keep their networks going, and to get initiatives going. So we've seen various initiatives building up around the world. I suppose one of our most successful ones was in Central and South America, where we had our initial strategic focus, and we've now seen a galvanization of countries across the region who are all kind of working towards this agenda. So that's many years later, and we're now shifting towards having strategic focuses in Africa and in Asia. So we hopefully see similar programs like that. So you might have people who are working very locally at grassroots level, but you might hopefully also have a leader that's trying to bring the whole movement forward.
And you have that big picture view, because we know that the dementia prevalence rates, obviously it's not just been about dementia, but we know that they're mostly going to grow in sub-Saharan Africa. That's where they're pitched to grow. So you can look in advance of that and say, well, that's actually an area where you particularly want to encourage people to apply. I'm assuming you don't give favoritism to applicants from certain places you're strategically looking at, but you might encourage more people from those places to apply?
Yeah, I think there's definitely targeted recruitment efforts, and like Dominic was saying, I think we know that people can do more together, and that creating these local networks is really important for just synergizing and, again, achieving the biggest change possible. So we will focus sometimes the recruitment efforts in regions, but we take candidates from all over the world. So
even if you're in a wealthy kind of country like the US or somewhere in Europe or the UK, I was going to say the UK. The UK is wealthy, right? We are still wealthy. That wouldn't put you in a worse position.
No, there's usually several fellows from combination of the US, the UK, Ireland.
It is part of the diversity of the cohorts as well, so that they could actually bring the different perspectives together and enrich everybody's experience. I think the lifelong approach is very interesting. It's because, as you say, they don't just finish and say goodbye. GBHI provides a platform for connection, for them to find common grounds and continue to work together, not only in the region, but also across the different regions and throughout the world. So they are common learning groups or study groups that still get together, interest groups they're called, where they still get together and discuss common interests, particularly from how to translate questionnaires into different regions, different countries, share some of those experiences. And I think that is something that makes this fellowship really, really interesting. That we provide that support as well. We don't just disengage from alumni. We try to bring them in as much as possible, try to keep in touch as much as possible. And we also have a growing numbers of regional mentors that help us support the fellows as they go back to the region, and now also have a way to connect with other regional mentors from the world. So we're really trying to expand and share the impact that we can have throughout.
So one of the things that Alejandro touched on is that every single fellow that applies to the program will develop a pilot application. So this is they will be applying for around 25,000 to take home to their home region and get that first step post-program as an ongoing initiative. So when you're thinking about a regional mentor, that's something that will be shared with a mentor in GBHI, that regional mentor and the fellow driving that process forward. So that very first step is just seeding what the next 5, 10, 15 years of their ambitions might be.
Fantastic. So for anybody who's listening who's thinking to apply, is there going to be another round of opening soon?
Yeah, so I think next spring we're looking to open the application cycle, so I'd encourage people who are interested to go check out the website. So
this is spring 2023?
Yes.
Okay, so sometime soon, but I think if you're listening to this and I'm not quite sure when this show's going to come out, but if it's March or April, it'll be opening soon.
Yes, absolutely, and we do an annual call for new applications, so if this year doesn't quite fit, you could know that reliably every year we'll be applying and taking a new cohort of fellows. And
if you're successful, I'm assuming the course is funded, you don't have to pay, is there a stipend? Practically. I know people will be asking that.
No, you're absolutely right. And I've asked the same question myself.
You pay us 50 grand and we take you on the course.
I won't be able to speak to the specific number, but every applicant, we went through a very rigorous process of making sure that what they're offered at the sites is benchmarked. So it's a fully funded program that if you're in UCSF or if you're in Dublin here in Trinity College. You've got, essentially similar level to what someone would be employed at as a research fellow.
Brilliant. I mean, genuinely, I can't think why anybody wouldn't apply for this, right? I mean, so this is a fantastic opportunity. I think if you're listening to this and you're an early career researcher or you're in a postdoc right now, we've done shows in the past where frustrated postdocs that are kind of getting a little bit annoyed that they've got stuck in this cycle of one position after another, but doing great work. This is a fantastic opportunity to take a year out, gain some new skills, get a perspective on different things, live in another country as well, work with an awesome group of people who you can collaborate with, write a grant application through the year, and get paid to do it. Well, this is brilliant.
I caught up with some fellows and alumni from the Institute to get their perspectives on different aspects of the programme.
I am Agustin Ibanez, Senior Atlantic Fellow from the cohort 2018-19.
So you love Dublin so much that you just decided to stay?
Well, absolutely. So Dublin, first of all, is one of the sites for the GBHI. It's a wonderful city, but it's a huge opportunity to support Latin American networking, research, and awareness. That is the most part of the work that I love it.
So where does your original work was from Latin America?
Yes. I am from Argentina, and I have been doing research in dementia for almost 15 years across different Latin American countries, including Argentina, Chile, Colombia, Peru, Brazil, Mexico. And before the GBHI, I was trying to create, in fact, a consortium, a Latin American consortium, because in that region the people work in isolation, they don't have funds, they don't have training, they don't know how to share data, and this is the region with the largest inequality in the world, and the inequalities have a huge impact in dementia. So I come to the GBHI with a big dream, but never imagined that we were able to do after that.
So what makes a researcher with an established career already within their field leave that to go and be a GBHI fellow? Why did you leave, and what did you think you gained from that?
Yeah. So first of all, I have a kind of internal crisis. I was just a typical researcher doing papers, data analysis, students, and that's it. And then I realized that this doesn't have a direct impact or immediate impact in the people. But at the same time, when I started to do multicentric studies, I realized that different centers across Latin America have the same problem. So I changed the view. I started to think about in the long-term impact of the research, how we can create capacity building, how we can empower in other people, how we can make emerging leaders, creating the space for them. So that was the big change. The GBHI really provides a global view that respects the regional challenges and barriers and specific aspects. So we were able to surpass the barriers that we faced in the region.
So how have you been able to put what you learnt from the fellowship into use, a few years on now? How have you put that into practice?
Well, I think that I was very, very lucky. We were able to do a lot of things. So first of all, we created the Latin American and Caribbean Consortium of Dementia that have almost 300 experts in the region, including national prizes, ministries of health, and it's a huge task for driving the main needs for dementia research and care in Latin America. Then we created the Latin American and Caribbean Consortium on Dementia, or REDLAT, that is a research-oriented consortium. We already have raised more than $24 million in research, empowering the region, doing genetics, doing social determinant of health, socioeconomic factors, multimodal neuroimaging, computational approaches. And then the last step was the Latin American Brain Health Institute that is founded by the Universidad Adolfo Ibanez and is affiliated to the GBHI. That is the only regional center supporting all our network in Latin America and promoting the brain health. So these three, LAC-CD, REDLAT, and BrainLat, are a direct consequence of the work that we started to do in the GBHI during my fellowship.
So through those collaborations and that inspiration, it's made you created these fantastic opportunities. Thank you so much for joining us.
My pleasure. Good. Thank you so much.
Thank you.
Okay, so hi, I'm Jayashree Dasgupta, and I'm a clinical psychologist with a specialization in neuropsychology. And I'm also a social entrepreneur who's based in India. So I have an organization called Samvedna Care, which provides services for mental health, active aging, and dementia care in India.
And is that across India, or is it in rural or urban, or?
So we're actually based in Gurgaon, which is an urban part of India near the capital Delhi, and we were initially, prior to the pandemic, a centre-based model, and then with all these lockdowns, we were really pushed to think about how we could start supporting people online, because that was the only way to kind of reach people. So with that, we've had to kind of repurpose a lot of the services that we had, and we're now, I'm very happy to say, kind of reaching out to different places and different states across India to provide online mental health support and services for people as well.
We often think about dementia in the context of what's happening in our own countries, obviously what we know. What impressions do you get for how dementia is perceived in India, and then how that compares elsewhere in the world?
Right, that's really important and a huge part of the work that we do, because a lot of people don't really know what dementia is, so you can't, and we provide services for dementia. So the first thing that we really have to do is create more awareness about what is dementia, how is this different from natural aging, because there's a lot of cultural perceptions around aging, the kind of decline is often seen as just a natural part of aging, really. And so it was really important for us to create more awareness, help people understand what are those initial signs and symptoms that they should kind of watch out for. And also help people realize that it's not stigmatizing to reach out to a mental health professional, or any professional really, if you have a doubt about the kind of issues that your a loved one may be facing. So I think these are the two kind of things that we had to really kind of work on, in addition to talking about the kind of services, the kind of support that people living with dementia and their families can get.
And I'm assuming, I imagine India is no different to other, to the UK or into the US, in so much as there's no one prevalent view of this, that it depends where in the country you are as to different attitudes towards this. Right. Is that the same in India as well? Are there parts of the country where, yes, there is more stigma than, or is it more accepted still that there are things that can be done and the brain health's an issue elsewhere?
I have to say, I think overall public awareness about it is low, but I've seen it change over the years. I think majority of India, people still don't know what is brain health. It's not a term. That's a term that actually we're using a lot more here at GBHI. But I think what people in India are still using is mental health, and that's more restrictive. And it is the term itself is in a way stigmatizing. So overall, I think public awareness is low across India, but definitely, at least amongst more educated urban regions, people are beginning to talk about it. So hopefully that's the way in which the message will start to spread across India, as well as probably more other low and middle income countries.
So how has this programme helped you personally for when you return to India to pick up where you left off before?
Yeah, so I think program's been absolutely fantastic. And for me, what's been really interesting is just getting to talk about the work that I've been doing back in India, sharing experiences of things that work, that don't work, and getting ideas from other people who've been working in not only in the space of dementia and mental health care, but just basically very diverse areas. So it's been really useful in terms of broadening the way to approach problems. And that's been really great. And I think that's going to be very helpful when I go back, in terms of at least trying to spread this message around, how to focus on your brain health, and how to, look out for signs, how to, seek help and support from, people around you, from systems and structures, and hopefully to get some advocacy going to, push for brain health across the country. So I think that's the kind of things that I think this program is really going to help you with.
Brilliant. Thank you very much.
Thanks.
Hi, I'm Zach Bandler. I'm from the United States. I'm a 2022-23 Atlantic Fellow for Equity and Brain Health here at GBHI, Trinity College Dublin.
What did you do before you became a fellow? Because we've heard throughout this podcast how people have very varied backgrounds. What did you do before you became a fellow?
So I've had a few careers, but I'm a film director and a screenwriter. I do narrative film, so as opposed to documentary, I do mostly fictional material. And then I was an actor for a long time before that as well.
Brilliant.
Yeah.
You know, everybody asks you, have you been in anything I would see?
Yes. Yes. Well, that depends. I was in a show called The Good Wife, a show called How I Met Your Mother, and most people know me for a show called Switched at Birth, which was on ABC Family.
Okay, and I've definitely seen How I Met Your Mother, and they've just redone that of How I Met Your Father.
Yeah, that's right, they did. Yes.
So how long have you been into your fellowship?
So we're about just coming on 6 months into the fellowship.
Brilliant. And what have you covered so far? We've heard we're going to be hearing this podcast formally what you covered. So what have you covered so far in the first 6 months?
Yeah, so they definitely throw a lot at you at the very beginning in terms of kind of the coursework and trying to get everybody on, just on the same page. So for those of us who don't come from a scientific or clinical background, it's been a lot of just introduction to neurology and brain health and various types of dementias and biomarkers and things like that. So that's kind of been going on in tandem with other skills they want people to develop in terms of leadership, in terms of how to make presentations or how to start writing grants. So it's very comprehensive. I will say, truth be told, the most riveting part of it has actually been the collaboration between the fellows themselves, because we're a very diverse cohort in terms of careers and where we're all coming from. And so a lot of collaborations have started to coalesce between everybody, and that has been very exciting. And I have a feeling it's probably what the mission, has been all along.
It's one of the aims,
yeah.
Isn't it? So from the things you've covered so far, is there anything being particularly surprised you? What is a kind of key takeaway that you've learned that you went, I had no idea, that surprised me?
Well, so I think a couple of things. It's interesting. I came to this with, as a filmmaker, I'm really passionate about, I come from Hollywood, and literally, and there's so many, dementia is viewed as a tragedy narrative in basically everything, right? You see these characters in various films and it's like they're kind of in a living death, right? And so something that's really important to me as a filmmaker is to start to change that narrative so that we can actually look at more hopeful stories about dementia, about brain health in general, but specifically dementia and brain injury. So for me, I think a lot of it has been mining the information out of some of these faculty who come from really distinguished backgrounds and deep levels of expertise in totally different fields that I can use to start to craft more hopeful narratives with, hard data to back it up. Now, is that, the most, that's not like the sexiest Hollywood way to spin something, but I think for me, accuracy is really, really important. On the flip side, I have felt very much that, I think sometimes the artists who might come into a program like this are a bit feeling like a fish out of water because everybody around us has a PhD and I just have a bachelor's degree from university. But what I have found is that I think there's a real need for better communication skills in the sciences and in research. And that's something that I do every day of my life, and so to be able to work, I just did a seminar on pitching, which I do frequently. I've pitched at HBO and Lionsgate and Sony, and I make TV and movies. And it was really exciting to watch, fellows really respond to like, oh my gosh, these are skills that we desperately want and need. And I was like, well, I have these skills, so let's work together.
And having sat through lots of neurology conferences, I can honestly say some of those skills would be invaluable to some of those neurologists.
Yeah, well, I'm a storyteller, so my whole thing is like how to build and craft story. And
so that's great, and that helps you really get over that initial imposter syndrome of gosh, I shouldn't be.
Yeah, absolutely. I think I've been, I'm entrenched enough in my career, certainly as a writer and as a director for the past 5 to 6 years, that I feel pretty confident with what I'm bringing to the table, that it matters. But you're right. I mean, there's definitely, there have been courses, seminars that I've sat through, and I'm like, I have no idea what we're talking about. But someone I can pull aside afterward, and say, so can you just translate this a bit more for me? And somebody can, and it's great.
And I can't help but feel that you've got to, even if in addition to filmmaking, of course, you're going to become the Hollywood expert on making films more accurate, and properly representing pictures. So inevitably, so obviously we heard the awful news that Chris Hemsworth found out he was a happily 4 carrier.
Yeah.
You can't help but feel that there's something going to come out of that later down the line. Some documentary you can
potentially so. Yeah, I mean, and I think there are little pops of that starting to kind of get through to the mainstream. I don't know if any of your listeners have seen Robin's Wish, which is about Ron Williams having Lewy body dementia. We viewed it here as a cohort, and that was a big deal. But nobody knew what Lewy body's dementia was before that. I think for me, I see that there's a lot of potential to bridge GBHI in Hollywood, and I'm really that's kind of become my mission in a way.
I think you'll be a great middleman. Thank you very much.
Thank you. Thanks for having me.
I'm afraid that's all we've got time for today, but if you just can't get enough of this topic, you'll find more information in the show notes with the podcast, or of course on the Dementia Researcher website, where we'll also have a full transcript, and we'll include any links that we're talked about today that would help you potentially apply. We'll also have biographies on all of our guests from today. So I'd just like to thank the incredible Dr. Dominic Trepel, the brilliant Dr. Claire Gillan, and of course the wonderful Dr. Alejandro Lopez Valdes. Thank you so much for joining us. I'm Adam Smith, and you've been listening to the Dementia Researcher Podcast.
Brought to you by dementiaresearcher.nihr.ac.uk in association with Alzheimer's Research UK, Alzheimer's Society, Race Against Dementia and the Alzheimer's Association, bringing you research, news, career tips and support.